In response to the HHS Synthetic Health Data Challenge, LMI is focused on enhancing the modeling of opioid use disorder, augmenting Synthea with the introduction of relevant social determinants of health. Synthea is a synthetic population generation engine developed by MITRE that simulates the lifespans of synthetic individuals from birth to death. There's an opportunity to include social determinants at a community-level scale, something important to patient-centered outcomes research. Our hypothesis was that if we included relevant social determinants of health with respect to OUD, we would better represent the complexity of the real world, more accurately capture population health statistics in meaningful ways at the local level, and in doing so, robustly account for unique to individual health factors. We focused on musculoskeletal pain, which is one of the leading causes of disability and chronic pain among adults in the US, and one of the most common reasons for which patients are treated with prescribed opioids. We focused on demonstrating a software development workflow, making our contributions through the data mining of secondary data sources for social determinants of health and modifying the codebase to assign them as new attributes within Synthea's synthetic individuals. We wanted to exploit the latitude and longitude coordinates of an individual's presumed residence in the legacy Synthea. These high-risk occupations that are known to lead to musculoskeletal chronic pain. We did this by augmenting the person constructor logic in Synthea to evaluate its household coordinates with the centroids of the surrounding census tract regions and assigning the most appropriate tract to a new attribute that each person would own. We generated a new data file for Synthea's reference folder that indexed by census tract statistical distributions for occupations in logging and fishing. The person constructor was then further augmented to reference the new data file using its new census tract attribute value. The end result was a synthetic population that closely matched the hyperlocal statistical characteristics of high-risk jobs in our geographical focus area. To demonstrate this, we needed to do two things. One, quantitatively specify the influence of occupation in fishing and forestry for the likelihood of chronic low back pain. And two, modify the relevant Synthea disease modules to leverage the occupation attribute of synthetic individuals and augment the transition probabilities accordingly for a higher likelihood of receiving prescribed opioids.
For determining the linkage between occupation and low back pain, we reviewed relevant published research and connected with researchers from the University of Maine. Our main focus was on peer-reviewed publications that examined the influence of occupation as a social determinant of health and how that leads to chronic pain.
Some findings of interest showed that in the occupation class of fishing and forestry, men had a lower likelihood of getting chronic low back pain, but women were over 2.5 times more likely.
We accessed the Synthea module builder and updated the transition probabilities in the disease module, prescribing opioids for chronic pain and treatment of OUD. In this module, the general adult population are all treated uniformly with respect to having the same likelihood of experiencing some kind of chronic pain. We changed this by leveraging the complex conditional logic that the module builder already has, accessing agent attributes for occupation and gender, and modifying the transition probability for chronic lower back pain accordingly.
Our primary validation focus was to get the number of prescribed opioids to be more representative of the real world and improve upon what the current Synthea software can do. So then we compare our ground truths with the current version of Synthea and our enhanced version.
We found that our Synthea enhancements perform slightly better than current software in matching against opioid prescription metrics for Penobscot County. Our effort has demonstrated a workflow that mines data sources for social determinants of health, in our case, occupation, Synthea codebase enhancements to operationalize those social determinants as new agent attributes, and how these new results could be used to improve the realism of Synthea disease modules. We hope our results helps lead to follow-on research by the community to further incorporate social determinants of health for enhanced realism and to continue the progress of Synthea and its important contribution to health research.